Tracy Eyre. I'm your chair for this webinar. I'm the programme lead for nursing within the digital readiness team at Health Education England. I work closely with Natasha Phillips and Sarah Nelson, and my main objective is to develop an accredited Masters and Advanced clinical practice for the digital work nurse, as well as an ACP framework as part of the ongoing professionalisation of the digital nurse role. I'm a registered nurse, critical care by background, and I've worked within clinical informatics in a large acute trust in the Northeast for the last 10 years, and I was the lead for the digitisation of Nightingale Northeast. What I'm going to do now is get the presenters and panelists to introduce themselves. So I'll start on my screen with Asha. Would you like to go first?
Hi, I'm Asha Cowie and I'm Workstream Lead for establishing the NHS Digital Academy.
Amy?
Hi everyone, I'm Amy and I am the Programme Lead of the Digital Health Leadership Postgraduate Diploma at Imperial College London.
Thank you. Caroline?
Hi, my name is Caroline and I'm the Divisional Nurse Informatics Lead for Oxford University Hospital from Cohort 1 of the NHS Digital Academy.
Thanks, Caroline. Sarah?
And I'm Sarah Nelson and I'm Cohort 2 from the Digital Academy and Deputy Chief Nursing Information Officer for England.
Thank you. And Josh?
Hi everybody, good to see so many on the call. I'm Josh Pagden. I'm the Chief Nursing Information Officer at Portsmouth Hospitals University Trust, and I'm about just over halfway through, I think, of Cohort 3.
Thank you. Just a little reminder for those that have just joined, we are recording this webinar, so we're assuming that by remaining on the webinar you're agreeing to that recording, and if you could just put your name, your role and where you're from within the meeting chat and any questions that you might have. Okay, we're going to move on and we'll start with Asha and Amy.
Great, thank you. I think Fern is going to put slides because I'm recording and we didn't trust us to both do them together. Fab. So you can keep it on the slide for a second, Fern. So the NHS Digital Academy and the consequent Digital Health Leadership Programme directly fell out of recommendations from the WOCTA review in 2016, where there was an identified need to develop and invest in digital leaders. We're going to see a video actually shortly from Natasha Phillips, which will highlight a bit more why this is important. And we have again selected Imperial College London as our partner to deliver the programme, which they'll be delivering with the University of Edinburgh and HDI UK for Cohort 4. We won't go into the detail of it today, we don't have time, but it's important to note our future vision does look to expand the different offerings. So over time, it will meet a wider range of individuals, there will be a wider range of offerings, and that's why the workstream is called Establishing the NHS Digital Academy, which sometimes sounds a bit odd. But for today, at a very high level, we're going to talk about the application process and the programme itself for the Digital Health Leadership Programme, and at a very high level, because actually what we want to do today is for you to get the most out of the session with the panelists and get the most out of the panelists. So as part of this, Amy is going to talk about programme content and academic aspects, and we'll try to cover sort of any Cohort 4 application, more technical questions in the chat, so that the panel can focus sort of more on their experiences and those questions. I've had a sore throat all of last week, and this is the first time I've spoken for ages, so bear with me and I'll try and keep going. Can you go on to the next slide, please, Fern? So in terms of who is it for, so fundamentally individuals need to be in a role where they're required to drive and implement practical digital transformational change within their organisational system. You'll need to evidence this in your application. Individuals also need to be working in an NHS public health or social care role in England to apply. We know that job titles and associated responsibilities are incredibly varied in this space, so we don't want to exclude individuals on that basis. So try to focus more on the application criteria and what you're doing in your job. Applications for the other 3 nations are not yet open, but we're currently exploring that. We'll keep our website and Twitter account up to date. And also just to note, for the 100 applying who are eligible for these 100 places, it is fully funded by HEE, and that includes the overnight stays for multi-day residentials. Individuals and organisations, however, would have to fund travel costs and other expenses such as meals while you're travelling or additional accommodation either side of the planned residentials. Next slide, please. So we have launched. Oh.
Sorry, Asha, which slide do you want?
No, that's fine. Run the timeline, please.
The timeline.
Yeah.
Ooh. Apologies, it seems to be a bit delayed. Oh.
I think it's up on the top somewhere. There you go.
This one. Oh, okay.
We got there. We got there.
Okay,
It's all
apologies.
good. We can probably ask Alex to edit that bit out. So we've launched our new website and we're open for cohort 4 applications. The website is quite new and we'll continue to evolve it. So any feedback is welcome so that we can continue to adapt it. Applications will close on the 30th of April 2021. And following this, we will undertake shortlisting with a view to notify individuals of their outcomes by June, July. We're also going to make feedback and signposting available to all applicants this year from July, August, not July, April. We're finalising the exact timeline, but as the application window closes, we'll update our website with a more precise timescale just to manage expectations. But it'll be partly dictated by how many applications we actually get and that sort of thing. Those who are successful will complete an academic admissions process with Imperial College London. I do want to highlight, we don't want degrees to be a barrier, however. It's not a prerequisite for applying. We know not everyone will have one. However, as part of the academic admissions process, you would be asked to provide academic records or equivalent professional experience. But just to highlight, this is a well-supported process, and if you're concerned about this step at all, then please contact us. Please don't let that put you off applying to the programme. And finally, I've got the residential dates on this slide. So we've got residentials 1 and 2 confirmed, so for September and December. They will both be virtual. Our preference for cohort 4, as long as it is safe to do so, however, is to include a minimum of 3 days in-person learning. This will be in a 2-day and a 1-day block, and we hope to get the rest of the dates and timescales up there soon. However, with regard to whether it'll be face-to-face or virtual, we might not be able to sort of plan that till closer to the time, and we'll continue to monitor the situation closely and make sure it's safe to do so. So we will, follow the website, follow the Twitter account, and we'll have all the up-to-date information on there. Next slide, please. So on entry criteria, again, all on the website, but at a really high level, you'll have 3 to 5 years of relevant experience in informatics or digital health. And one of the questions we keep getting asked is, do you have to have been in a formal informatics role during that period? And the answer is not necessarily. We know a lot of people will start by sort of dabbling in informatics and projects within a different role. So I think, don't get too hung up on whether your formal role has been 3 to 5 years or not. You'll need executive level support from your organisation. You'll need to be able to attend all experiential learning and live teaching, which, as I've just mentioned, may be in person or virtual. You're empowered and supported to apply new skills, learning and behaviours within your organisational system. This is why the exec sponsorship is really important. And we also want you to have fun. And I missed one. So we want you to demonstrate commitment to the professionalism of our workforce. And actually, it's great. We've got the video from Natasha coming up. Next slide, please. So what will you be able to do differently? So as part of the programme plan, and Amy will touch on this a little bit too, you'll start by setting out goals for the year in a personal development plan, which should be agreed with your exec sponsor. And from the start and then throughout the programme, you'll very much be expected to engage in reflective practice about how you're progressing towards those development goals. As part of the programme, you will identify themes or programmes of work which are of strategic benefit to your organisation, and then you will apply your learned skills and knowledge to practice in the workplace. This will enable you to apply best practice models, frameworks and approaches to your day-to-day work. You'll use learning journals to support your reflective practice. Reflective practice can be a bit strange if it's something you're not used to. And this will enable you to capture the translation of your learning into practice to achieve real world impact and change. And finally, at the end, you'll come together to celebrate with your peers, both to look at your professional growth and the impact that you've made in the workplace. Next slide, please.
And I'll take this one. Here I want to give you a quick glance across the programme. We'll start in August with a digital onboarding that will give you access to Imperial systems as well as to pastoral support and short modules preparing you to academic study on a postgraduate level. And here you can see at the start, from module 1 onward, we'll be giving you a grounding in overview of health systems, and gradually we'll introduce you to more specific specialist areas. These modules are delivered online using blended learning, live webinars, and assessment tutorials. The leadership module that you see in the bottom left corner there, it's called module 6. It's about leadership, and it runs across the year, parallel and in dialogue with your online modules. And this is the one that will start with agreeing your personal development plan with your executive sponsor, and it will be the kind of key theme for the residentials that will be virtual and hopefully in person later in the programme. Module 6 will help you forge connections across the cohort to collaborate with others. It will guide you on how to apply learning to your work and inform your reflective practice that will accompany your learning journey. Next slide, please.
Back to me, I think, to finish up. So support throughout the application process. We have skimmed this at a really high level today. We have dedicated application webinars, which are 30 minutes focused on the application process and digital health leadership programme in more detail. Please do come along to one of those if that's helpful, and we'll go through things like the actual questions and criteria in much more detail. We're going to also try and record the one that we do this week. So if people can't attend, that recording will be available. Panel sessions like this one. So we're doing this one today with a great lineup. We're doing one with HPs later this afternoon. We're also doing 2 in collaboration with One Health Tech and FedIP, the Federation for Informatics Professionals. Feel free to come along to them. Don't feel like you're restricted due to your role. Come along and join and listen. We've got the provision of an application checklist and supporting guidance on shortlisting criteria on the website. Again, when you get these slides, you'll be able to click through the links on the slides to take you to the right bits of the website. Online content, which we'll be releasing over the next few weeks throughout the application window. Support with inquiries, email, Twitter, and of course on these webinars. And also, if you have a look around our website, you'll also find other work we've done to support this process around inclusive recruitment ahead of cohort 4, as well as our future vision work. So hopefully that's helpful as a high-level overview. As I said, me and Amy will try and tackle any application questions in the chat. So do keep the questions coming through for the panel themselves. And I think Fern is just going to play a quick video from Natasha Phillips before we move on to the panel.
I think the Digital Academy is really, really important because without the workforce that's got the digital knowledge and skills, and I include in that the leadership skills, the skills in clinical change, and the expert knowledge about data science and leading technology changes, we can't transform our NHS. We can't transform the way we work. And as we've seen in the COVID pandemic, there's a real advantage to working with digital technologies. It can really help us to change the way we work, to deliver the long-term plan, bring care closer to patients. Things have fundamentally shifted, and now more than ever, we need people with the knowledge and skills to lead that change and to consolidate what we've done thus far and take the best of it and think about the what next. So the Academy is particularly good at developing leaders for digital change, and it's really important that we have those from all clinical professions, and from other professional groups who work daily in delivering healthcare. I think it supports in a number of ways. Firstly, obviously with the content, so the very carefully considered content to make sure that people do have the requisite knowledge and skills to lead digital transformation. But importantly as well, I think it's about the community and the network that's built, and that goes way beyond that learning and well on into people's careers. If I think of my own experience of doing a scholarship, so I did a Florence Nightingale Leadership Scholarship some years ago. To me, I describe that as the gift that keeps giving, because even now, I still feel the benefits of that and still reach out to the people that were either in my cohort, in other cohorts, or I was afforded the opportunity of connecting with through the programme that helped me in my day-to-day work. Nurses and midwives make up a third of the workforce, so it's fundamental that they're there. I think when digital transformation is done well, we consider people, process and technology. That means having deep expert knowledge about the work that you do and then how technology can support that. Nurses have been underrepresented in this space, and so often it's commented on by nurses and others, we see it in practice, that they're digitally done to. They end up with change that doesn't really help them do their work. And that's bad for nurses, it's bad for patients, and it's bad for everyone, because ultimately we find we have a problem with adoption. So we are going to need lots of nurse leaders who are able to articulate what nursing does, bring that specialist knowledge together with the knowledge they get through a program like this to lead the profession forward with others. And we definitely need to do that with others. This is about bringing everybody's collective individual expertise to the challenges to make it work. So they get to be part of a community of digital leaders from all sorts of professions, doctors, AHPs, informaticians, and operational managers, all coming together to learn together, to go back into the workplace to make a difference for our patients.
Thanks, Fern. Just wait for Caroline. What we're going to do now is talk to our panel. As I mentioned before, we've got a member from every cohort. So what we're going to do is we'll start with Caroline, who's from cohort 1. Thanks, Caroline.
Thank you. Hi, everybody. So I'm Caroline from Oxford University Hospital, which I mentioned earlier, and I'm from cohort 1. I work as what I do is we provide strategic direction and clinical leadership within the organization. So what's exciting about my job as a divisional nurse informatics lead is we bridge the gap between the clinical, the IT, and the electronic health record team. So this NHS Digital Academy course had helped me very much into performing better in my role and using all the theory into practice.
Thanks, Caroline. Sarah, if we can move on to you as cohort 2.
Absolutely. Hello and welcome everybody. It's lovely to see you all. So I'm Sarah Nelson and I'm now Deputy Chief Nursing Information Officer. I certainly wasn't when I came for the Digital Academy. There's been quite a lot of growth through that time. Tracy, are we doing, sorry, is this introductions now or shall I?
Yes, tell us why, how.
I thought it was probably a nice idea to just sort of talk through sort of some of my time, why I applied for it, and then sort of what happened. So if I can start with, I, along with an awful lot of nurses and midwives and AHPs out there, didn't have technology when I first came into nursing. And I do remember that computer on the side that came into our critical care coronary care unit at that point, and the impact that it had on me at the time. So I didn't have anything to do with technology. And then, as Natasha was just mentioning, that digitally done to part of you that suddenly feels like, oh, we've had a lot of things brought in, and when it works, it's brilliant. And when it doesn't work, my word, it really does impact on us as staff members and also the patients. So when there was the opportunity to move out of my operational role and very much into IT, and there was this role to work under the CCIO and CNIO at one of the London teaching hospitals, to help that communication between IT and the technology services and the clinical teams, that was where it was like, yes, please, can I do that? Because I really, really want to make that difference between it being okay and it being really, really useful for us. So I did that for about 3 years, and I was on that cusp when Caroline's year. I didn't have the opportunity to go for it in Caroline's year, or I certainly didn't feel at that stage that I was at the right stage to do it. But by the time the second cohort came round, I'd had my 3 years of time working between IT and clinical services, and thought, why not? Let's give it a go. And the reason that I went for it was because I don't know whether any of you noticed on my little icon when I turned off my camera a short while ago, but my little icon is a Lego man. And it was a Lego man that was given to me because it's Sarah the nurse, Sarah with a stethoscope around her neck and a syringe in her hand, but also Sarah having this little phone in my other hand. And I very much understood my nursing side of me. But what I didn't understand was the professional informatics side of me, that because I'm not a techie, and I know there's a lot of people who are coming through now who are, and I think it's fantastic, but I wasn't particularly at that stage. But what I was somebody who was really interested in how we could change that. So I went through the application process. I would say get onto those application, how to do it, because for me, I made a little bit of an error when I turned around and thought it said 2,500 words, not 2,500 characters. And I went to put it in and went, oh, no, I put too many. So do read your application form and do put your application through. I did have to go through the certification side of things because I had my degree. Could I find my certificate? And could I certainly find my certificate for my GCSEs and my English and things? So I did have a couple of certificates that I had to get. Did take a bit of time, but actually most of the universities are so easily set up for this nowadays. So please don't worry about your certificates. That first day, a little bit of a feeling of inadequacy. I was surrounded by an awful lot of people who seemed to know exactly what they were doing. And I sat there and thought, well, I'm a nurse and I'm nice and I'm really interested in this, but what else am I? What else have I got to give? And what this program really taught me was about using your skills to actually bring about this transformation and to be a part of this team that would help to do that. One of the things we did was we looked at our skills and did a review through one of the particular sessions that you can go and do. And I found out that actually my niceness wasn't actually niceness, it was actually empathy. And you really need empathetic leaders, because if you don't have empathetic leaders, then the ability to actually understand why we're doing this and the impact it has on people is really quite difficult if you don't have empathy within the team. And it's not that everybody has to have it, it's just that actually it was a skill I realized I had and I hadn't given any credence for before. So I would say definitely look at those skills that you have and you learn through the program what that is. I've got lots of other things that I'd like to talk about, but one of the main things is the fact that you become brave. You realize, there is no reason I can't give my opinions and my thoughts on this. And you learn to become brave when you suddenly they give you, at one stage, I don't know whether you've had the same, Josh, but we had a 90-page document to read that was a business case. And you suddenly get thrown into a room with 6 people you've never met before out of your cohort of 100. And you get told you've got 30 minutes to actually do a presentation to the board. Those sort of things make you think, actually, in my everyday world, that's probably a good idea, because I need to learn how to do things in a way that actually works for my the way that I do my work. So I'm going to stop here and say back to Tracy. Thank you very much. We'll talk any more as the questions come out.
Thanks, Sarah. Yeah, if anybody's got any questions, make sure you put them in the chat and we will get to them. Josh, can I then pass on to you as cohort 3, our most recent, to talk about your experience?
Yeah, absolutely. Thank you. Yeah, really interesting listening to both Caroline and Sarah there. Yeah, I think you covered a number of the things that I was going to touch on as well. So I think, no, it's good. It's shared experiences. So yeah, I'm Josh Pagden. As I said before, CNIO at Portsmouth Hospitals. So in terms of why I got into this, it started as a personal recommendation for me. Our CIO had done the course previously and was really enthusiastic about it from the content and the networking point of view. I was relatively new into my current role, coming from site management, and prior to that, emergency department nursing. I'd been involved in change and some digital transformation work, but not as part of a core team. But it was something that was a driver for me, just the desire to introduce quality, safety, and efficiency improvements that I could see were a possibility. And we were at that point in time, we had the team coming together to be able to do that. And this, looking at what the content of the course was, it just seemed to cover a lot of the gaps that I saw in my own knowledge and experience. And as someone recently starting as a digital leader, I certainly had a sense of some imposter syndrome starting out, and I very much was hoping that the course would help me to overcome some of that. So, I mean, I can say, being halfway through the course, that it has been 100% beneficial for me in my ability to conduct my roles. I've never really had, been on a course quite like it, where, as Sarah was mentioning before, one day I was doing a pitch to a board. We'd had a few minutes to prepare, a load of different people I'd never met before, and we were running with it and doing it all virtually. And literally the next week I was pitching to our board, and just found that, I found that on a number of occasions with this course, you're covering a topic. The very next day, you're putting it into practice. So it's been hugely beneficial. I just wish I could have started it a bit sooner. So the nature of the course is such that even when you're writing your assignments, you're encouraged to reflect on how it applies to your own practice. So yes, it's contextualized. You get the opportunity to hear from a number of leaders. We've heard from Natasha, Philip, Simon Eccles, Sonia Patel throughout the program, and just had the opportunity to learn about their vision for the future, which is really exciting when it comes to taking that back to your own organization and reflecting on what it means for you. Also, as Sarah mentioned earlier, the diversity of the different participants is great. So as a nurse, it's been really helpful having other nurses on the program and being able to talk together about our shared experience. But I think the main thing is just the diversity of people that you get to work with. From CIOs to AHPs, pharmacists, other nurses, doctors, all as a team, all getting to understand what you can contribute. I think that really helps to give you what perhaps is, for me, the most important thing from the course is its impact on my own personal development, my own confidence in myself and what I can contribute, and my role within the team and within the organization. So it really builds that confidence that you have to then go back and lead digital transformation in your own workplace. And I think I just have to pay a lot of credit to the people who've organized and put together the course. It's clearly taken a lot of thought and time, effort and inspiration to bring together something that is really relevant to our practice. So thank you. That's me, and I look forward to hearing some questions from everyone.
Yeah, thank you. We only currently have one question within the chat, and it's from Dale Carrington. He's saying, how are information officers different from informatic officers? Would one of the panel like to? Sarah, you've got your hand up.
It's an interesting one, isn't it? Because I remember having this conversation with Natasha when we first got into post about, are we informatics or are we information? Traditionally, information has more been on hardware and the software and the data. whereas informatics is more about the systems around it and the whole and is a greater sort of part of it. Having said that, if you look at international titles, information is where it's Chief Nursing Information, Chief Clinical Information Officer. So it's the information that actually is with international titles and titles that we have. So at this moment, certainly we've chosen to stay with information. However, informatics is possibly more the way we're going. I remember in the academy having a conversation where we were invited to sort of say whether we were informatics professionals. And I remember being quite upset and quite sort of shocked initially and thinking, no, I'm a nursing professional. I'm not an informatics professional. But actually over time, I realized that in order to do this job, I needed to understand the science behind what we were doing, and I had to understand the informatics side of things. So I think that's just how I see it. I think its information is more the original hardware, software data, and then informatics is wider, but that's why we've kept the titles we have.
Barbara Arroyo has also asked a very similar question. She's asking what's the difference between a digital nurse lead and a chief nursing information officer? Would someone like to take that?
Well, I can answer some part of that. So because of this confusion, what we're doing at the moment, I'm also a member of the Faculty of Clinical Informatics in UK, and part of our work is to develop a core competency framework for the chief, you can say, clinical information officer. That could be a physiotherapy and OT or any other clinician, nurses. And this group is now working on developing a job description, an exemplar job description, to hopefully understand what is the role of a chief nurse information officer or clinical information officer. And if you'd like to learn more about it, I'd encourage you to check out the Faculty of Clinical Informatics website, and you should see the core competency framework that had been developed recently, and we'll give you an overview of what these job information that we should have, job description in theory that we should have as a clinical information officer.
Thank you. Josh, Sarah, do you have anything you want to add to that?
I'd just add that, yes, nationally, it is one of the things that Natasha and I are looking at, is that job description that supports any role, whether you're a nurse, a midwife, or whoever, to become, because it's the job we do and it's those extra skills that we would need. I think from the point of view of nurse leads, digital nurse leads, I think there's an awful lot of people who are in roles and there's no real standardization at the moment, and it's one of the things we've just literally done a review throughout the country and had some responses back from about 176 different trusts that explains where we are nationally, because we didn't know before where we were nationally, and that will be coming out shortly. But I think there's an awful lot of people who will be digitally interested. I think there's a lot of people who actually throughout their careers now, digital will become a part of our everyday practice because it's technology enabling the work that we're able to do. However, there will be some of those that might want to go on and do digital nurse leading, and some will want to go on and take it that next step further to the Chief Clinical Nursing Information Officer.
Thank you. We've got a question from Sarah Harper, who is asking, did your own project ideas change direction over the duration of the course? Did you start off with the same project and lead all the way through, or did anybody have any changes?
I personally did not have any changes, but I know some of my peers did. So I find that it can be quite challenging, but they were guided by the mentor or the advisor for the course. So you will be very much supported, whatever decision you make throughout the course. So you shouldn't be worrying about that, just in case you go through that.
Josh, did you?
Yeah. So my thought on that is that much like Caroline, we've got the same projects well, I have the same projects that I'm helping to lead that I did at the start of the program. However, what the program does is it sort of encourages you to think differently about them, about their ambition, about how you're evaluating them. It gives you a number of tools to do some of those things as well that previously you may not have had to hand. The range of different tools around implementation strategies, around engagement, or around evaluating the change or the digital technology that you're using. So it provides you with a lot of tools, a lot of ways of thinking, and it causes you to challenge what you're doing, challenge yourself, challenge your thinking, and what your team are thinking. So the core projects are the same, but I think in terms of how we're delivering them, our ambitions, some of the things that we're including, that has transformed as a result of the program.
Great. Amy, you've got your hand up.
Yes, and I just also want to say that we've seen a lot of changes in both the direction of projects, but also people have been redeployed. So in terms of the academic support that's in place, we fully anticipate that this would be something that is an ongoing issue during the next cohort as well, and we are quite determined to keep supporting you in whichever role you end up in. I know that some of the participants they set out an initial project and then either themselves or their executive sponsor had to move jobs in the meantime. So these are all scenarios that are quite familiar to us, and we're happy to support throughout.
Thanks, Amy. I don't think we have any other questions. I think Barbara has put in a statement. I don't know if you can see that.
Barbara, sorry, let me just jump in here. I think that what Barbara is driving at is more on the professionalization agenda. So I do wonder if Barbara, if you are in a situation, do you want to kind of summarize and ask your question? And I wonder if we both from the FCI and from Sarah's perspective could maybe help a little bit.
Sorry. No, I'm just very interested about the leadership that is being talked about, but it's so important to create that network in the organization as well. And I suppose the question, sorry, I keep writing because, it generates so many ideas, doesn't it? The question is, is part of that the learning and the skills, is it also to develop other people within your organization? I suppose the question is yes, but I'd just be very interested to hear what your thoughts and what your learning has been to date, because I think it's about getting allies on board and things like that.
Can I jump in on that one? Just sorry, got a hand up. Sorry, I just interested in that question because that's absolutely been something that's come out of my participation in the program. You sort of appreciate anyway the importance of having people behind you and that engagement and building up that support base. But it does sort of reinforce that. One of the things that we've started to develop where we are is a champions network to help support the program that I'm leading, but also a number of subsequent projects that'll follow on from it. So I think yeah, how you think about your organization, how you think about their skills and abilities, and what their needs might be to support some of the change that's coming down the road is very much something that that is developed. But I think what's also important is that it's different for everyone. So where you take your different projects or your different lines of inquiry is very much rooted in where you are, what your projects and the needs of that workforce are. So I think people will have different experiences on that.
Thanks, Josh. We've got Asha actually put a question in. She's saying, what's the biggest change you've made in your approach to your professional work following completion and participating in the programme? Do you want to start with, should we go around the screen and then we'll maybe try and tie up after this? Caroline, if you want to go first.
Yeah, so I think from my end, the course has definitely exceeded my expectations. Reason being is I have taken more responsibility in the organization, because initially my role was just for one division, but because of the NHS Digital Academy and the project I'm working with, I have to be involved in a larger project, and this involves work between two trusts. I have extensively applied theory into practice when I did go through that transformational project that I had to do, and it's about enabling. I learned about enabling change and being more engaged with the people, really listening to what matters and be more empathetic, like mentioned by Sarah earlier. And it also taught me to keep finding new ways to innovate and help create and drive strategy across the organization. Now, it's not just about digital. It's about the use of technology to improve the practice, improve the workflow within the organization. And also another thing that helped me is I learned that empowering people and engagement enhances productivity, and that's how I should be thinking when I'm working with everybody within the organization and even with the patients in our trust.
Thanks, Caroline. Sarah, how about you?
There are a couple of things actually. Sorry, Esther, I'm going to say more than one. But certainly the involvement in patient and public involvement strategy in my previous role, that was quite important and came out through lots of discussions throughout the academy about sort of why we're doing this, what's all this about, and so there was definitely some stuff with that. I also developed a real professional responsibility to speak and to actually be brave and do things like this, but to be able to turn around and say why it's really important for a nurse to be involved, to be able to talk about why us, why me, what. And I remember being told, sort of, Sarah, nurses don't get the opportunity necessarily to do this, not every nurse. So you need to be there and you need to be able to support your colleagues in coming through. And so that certainly gave me a lot of, I started to do more Twitter. I started to be more involved in actually accepting some of these sort of discussions and conferences and things like that, which although can be extremely scary, and you just think, why? Actually, it was really, really important. And of course, that then gone on to my biggest change, which was that brave step of thinking, well, why not? Let's go for a national job. Why not? And the new role. So that was certainly my biggest change, and one that I'm just sort of 3 weeks into now, the main role. So thank you for that.
That's great. Thanks, Sarah. Josh, what about you?
So things that have changed for me, I think you do quite a bit of reading during the course of the challenges of transformation and implementing change, and it sort of goes back to my last response, the response to the last question. Just understanding the importance really of bringing your teams with you, bringing the nurses who are having to use the technologies that you're introducing with you, and allowing them to be part of it and own it, and help to contribute. And so I think for me that's it's one of the most enjoyable things to do, is that sort of working alongside and empowering people. But in terms of making your life easier, I think it's probably one of the most important as well. And then secondly, it's really given me the confidence to think bigger and think a bit more strategically, thinking beyond just my organization, beyond just the next project, but thinking longer term, thinking how we can work together to achieve, to achieve the, longer term sort of strategic goals that we might have for our region, or, so it's putting more pieces together as part of that jigsaw, and understanding how that, how information, data, and those relationships that help to drive change are important.
That's great. Thank you. Well, I hope it's been a valuable session for you, and it has given you the energy to apply. It's really important that we get nurses into the Digital Academy as a voice for change and for a voice of ownership. I think what we'll do, yeah, as Sarah says, just go for it. I think we need to, I don't think we've got the link in the chat yet to the webinar for the application process. I think I saw the Faculty of Clinical Informatics, but I haven't seen that one. So we'll try and get that one in. Oh, Caroline?
Yeah, I don't want to forget this, but I wanted to tell everybody this. So don't be afraid, just go for it. When I applied for it, it says this is an application for CCIO, CNIO, and aspiring digital leader. At that point, I was just new in my job. I was 1 month on my job, and I said, "That's it. That's me. That's the aspiring digital leader, and I will go for it." So it was challenging. I have to go through interview because I did not study in UK. I had to do an essay to submit before, and also I have to have my English language test just to be a part of the academy. And then I got in, and there are 6 nurses in the course, in the cohort 1. 5 of them are CNIO, and I'm the only one who's nowhere near being a CNIO. And really, just go for it.
Thank you. I think it's fair to say that year on year there has been an increase of nurse presence. How many are on your course, Josh, as the most previous cohort?
I've lost count. I'm sorry, I don't know how many, but
That's
there
okay.
are quite a few of us. More than 6.
Well, let's try whatever that number is. Let's try and double it. That would be fantastic. Asha, Amy, is there anything you want to add before we sign off?
No, I think Fern's popped the application stuff in the chat. We've hopefully got lots of resources to help people with the more technical side of the application. I'm happy to help, and you know, just thank you.
Yeah, thank you very much for attending. It's been a pleasure, and hopefully this time next year we'll be talking to you as cohort 4 in the next webinar for cohort 5. Thank you very much.